Welcome to the module, Proper Technique for Blood Pressure Measurement, a Frontline Forces training presented by Superior Health Quality Alliance or Superior Health. This learning module was developed for direct caregivers who are responsible for taking blood pressure measurements working in multiple healthcare settings who care for a variety of patients. Direct caregivers play a very critical role in providing care to individuals across care settings. Why? Because direct caregivers spend a great deal of time with their patients, which helps them to know and better understand the needs of these individuals. The purpose of this course is to further your learning and build on your current knowledge about blood pressure measurement. What you know and how you use that information improves the quality and safety of the patients you care for. Once you have completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. Upon completion of this module, the learner will be able to describe techniques required for accurate blood pressure measurement and demonstrate proper technique to achieve accurate blood pressure measurement. Now let's walk through the steps for proper blood pressure measurement together. Our first step is to choose the right equipment. What you will need is a quality stethoscope if you're using a manual device. Whether you're using manual or automated equipment, you will need an appropriately sized blood pressure cuff for that patient, and we will review how to make sure the blood pressure cuff fits correctly in a moment. And you will need a blood pressure measurement device, either manual, semi-automated, or automated. Step number 2 is to prepare the patient to have their blood pressure taken. This step is important regardless of what type of device you're using. Before measuring the blood pressure, you want to allow the patient some time to rest. 5 minutes is what is recommended. This makes sure that if the patient has just walked in from the lobby, for example, it gives their blood pressure some time to return to normal. Have the patient seated as you take the measurement. Make sure you're using the correct cuff size. Using a cuff that's too small could add 2 to 10 millimeters of mercury to the patient's reading. Put the cuff on the patient's bare arm. If the cuff is placed over clothing, this could add 5 to 50 millimeters of mercury. It can also make the pulse sounds difficult to hear if you're using the manual method. If the patient is rolling up their sleeve to have their blood pressure measured, you also want to make sure that it's not too restrictive and that you can place 2 fingers in the sleeve of their clothing. Support the patient's arm at heart level. Incorrect support could add 10 millimeters of mercury. Often these patient positioning factors will depend on the setup of your exam room or wherever you're measuring the patient's blood pressure. It's best if the patient is seated in a chair with an armrest or a tabletop next to it. You can also use your waist to support the patient's arm. Just make sure that the patient is not supporting the weight of their own arm. Make sure the patient is seated with their legs and ankles uncrossed. Crossed legs can add 2 to 10 millimeters of mercury to their reading. And while the patient is seated for the measurement, make sure their back and their feet are supported. Unsupported back and feet adds 6 millimeters of mercury. Make sure the patient has an empty bladder. If the patient needs a urinalysis, try to do this first. A full bladder can add 10 millimeters of mercury. Make sure there are no conversations going on in the room. If the patient is talking or if they are actively listening, this could add 10 millimeters of mercury. These patient positioning techniques will assist you in obtaining an accurate blood pressure reading, whether using the automated or the manual method. Step 3 is to choose the proper blood pressure cuff size. Most measurement errors occur by not taking the time to choose the proper cuff size. A cuff that's too large underestimates the blood pressure, and a cuff that's too small overestimates the blood pressure. To make sure you choose the correct size, there is an index line that runs along the width of the cuff. As you're wrapping the cuff around the patient's arm, you want to make sure that line falls within the range that lines the top of the cuff. That lets you know that the cuff size is appropriate for the patient. If the cuff falls on the inside of the range, you know that the cuff is too big, and if it falls on the outside of the range, the cuff will be too small. The cuff dimension by arm size reference tool spans measurements for all age groups. If you come across a patient whose arm does not fit a large or an extra large blood pressure cuff, you can use an adult thigh cuff on the upper arm. Step 4 is to place the blood pressure cuff on the patient's arm. Palpate the brachial artery at the crease of the arm and position the blood pressure cuff so that the artery marker on the cuff points towards the brachial artery. Wrap the blood pressure cuff snugly around the arm and apply the 2-finger rules to make sure the cuff is snug but not too tight. You should have 2 finger widths above the crease of the arm to give you room to place the stethoscope, and you should also have 2 fingers that should fit between the arm and the snugly wrapped cuff, making sure that it's not too tight. Step 5 is to position the stethoscope. If you are using manual equipment, on the same arm that you placed the blood pressure cuff, palpate the brachial pulse at the crease of the arm. Then you will place the diaphragm of the stethoscope over the brachial artery at this location. Step number 6 is to determine the maximum inflation level. This is known as the auscultatory palpatory technique. This is a technique for you to use to determine how high you should be inflating the cuff if you're using the manual technique or device. This is to avoid over or underinflating the blood pressure cuff. For example, a patient who typically has lower blood pressure readings does not need the cuff inflated as high as someone who has a higher blood pressure, and that would help make the patient feel more comfortable. Also, if a patient has a high systolic value, this would accurately capture that. The first option with the maximum inflation level technique is to inflate the cuff as you listen to the brachial pulse. The cuff is on the patient's arm, the stethoscope is located over the patient's brachial artery, and you are going to slowly inflate the cuff until you hear the pulse sound disappear through the stethoscope. Look at the gauge and note the number where you heard the pulse sound disappear, and then proceed to inflate 20 to 30 millimeters above that level. Deflate the cuff and take the blood pressure measurement. Option 2, the cuff is placed on the patient's arm, but for this method, you do not need to use the stethoscope to determine maximum inflation level. Inflate the cuff as you palpate the radial pulse, and note the gauge reading once you feel the pulse disappear. Inflate the cuff an additional 20 to 30 millimeters above this level when you're taking the blood pressure measurement. Step 7 is to slowly deflate the cuff. If using an automated or semi-automated blood pressure device, this will be done automatically after you press the start button. With the manual technique or device, you will begin deflation by gently loosening the thumb valve. You want the pressure to fall at about 2 to 3 millimeters of mercury per second. This is to make sure you are noticing the pulse sounds at the right level. Step 8 is to listen for the systolic reading. The first occurrence of pulse sounds heard as blood begins to flow through the artery is the patient's systolic pressure. This is the top number representing the pressure in the blood vessels when the heart beats. Step 9 is to listen for the diastolic reading. Continue to listen as the cuff pressure drops. The diastolic reading is when the last pulse sounds are heard before all sounds disappear. This is the bottom number, or the pressure in the blood vessels when the heart rests between beats. Step number 10 is to double check for accuracy. If the blood pressure is over 120/80, it's recommended to take a confirmatory measurement to determine if the patient's blood pressure is in fact elevated. Make sure you wait at least 1 to 2 minutes in between readings. Note the individual readings. An average is what's giving you a snapshot. Some of the automated devices will do this for you automatically. Congratulations! You have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the proper technique for blood pressure measurement quiz on the Frontline Forces webpage or in the YouTube description below.